Hello, good morning. I'm Dr. Preeti Gupta. I'm a homeopath and I'm practicing in Delhi since last 7 years. So today I want to talk about a very important topic which I witness in my OPD on daily basis. It is about the dairy dilemma, or in a simpler words, if I put it, the lactose intolerance or dislike for the milk and milk products. So, what are the reasons why people are giving up milk and milk products, and what are the benefits of having milk? What are the disadvantages of having milk? Whether one should consume it or not. So, I want to highlight this topic today. Uh, so, giving up dairy is increasingly becoming a common for reasons ranging from allergy and from ethics also, ethical point of view also, that people are converting into vegans. And so people are left with a big question, whether I am foregoing something very healthy and important if I'm not consuming milk and milk products. So first of all, what does milk and milk products contain? It is an essential source of vitamin A, calcium, vitamin D3, and phosphorus, potassium, selenium, magnesium, and even a very important vitamin, which is vitamin B12, which is majorly found in the non-vegetarian sources, like meat products, your eggs, poultry, etc. So, who are the ones who should avoid milk and milk products? So, people who are lactose intolerant, having skin allergies. If you're having a patient who is coming into an OPD and is having a skin allergy or any kind of gastrointestinal allergy, so we send the patient for the investigation, and after running the tests, we find out that whether that patient is allergic to milk, especially whey and lactose. So whey and lactose, they're basically found in cow's milk, a very important protein, which is casein, whey, and lactose, albumin. They're the culprits, they're major offenders in such cases. So we need to put that patient off dairy completely. And one of the major problems also is because why we are against dairy and dairy products. There are a lot of debate which is happening around milk, the debate among the doctors, the nutritionists, the dietitians, whether one should consume milk or milk products or not. So it is also seen, milk aggravates certain conditions like gastritis, um, irritable bowel syndrome, which is also known as IBS, including the Crohn's disease and ulcerative colitis. It is also patients are having symptoms like vomiting, nausea, distension, abdominal distension, um, problem with the bowel movements, etc. So people with heart ailments, high cholesterol level, obesity, they also tend to aggravate if they consume milk and milk products, especially high fat milk. So milk becomes important. It becomes good for health if you are taking it in a particular quantity and a very good quality. Nowadays, what is happening is that what we see, the cows are not fed on a proper good fodder. They're artificially inseminated. There is a lot of adulteration which is happening, and which causes increase in the hormones. We can find a lot of hormones in the milk, like testosterone and estradiol. It is also leading to early puberty and early menarche in a lot of young girls. They're menstruating around 10 to 12 years of age. Earlier, they used to menstruate from 14 to 15 years of age. So there are a lot of problems also which are happening because of dairy and dairy products, and that is causing the problem. So if you consume a particular serving, like one cup of milk per day, and if you're not having any issues, you're able to digest milk properly, then well and good. And make sure that the milk is in a good quality milk, cow's milk, and you're not having any skin problems, you're not facing any kind of distension, not facing any kind of bowel issues, then well and good. But if you're having problem with the dairy, it's okay if you skip it totally, because we have other sources of nutrients which are able to suffice for the dairy requirements. So what are the other sources of dairy products? So dairy products are basically they're found in plant-based foods which are rich in calcium. They are soybean, cooked soybean. It is also found in tofu, green leafy vegetables like spinach, beans, lentils, dals, pulses, bean sprouts, coconut milk, then almonds, badam, and mustard greens. One very major and very popular health food which we hear on the daily basis is kale, and kale is also a good source of calcium. And nowadays it's winter time, so we are consuming a lot of till, so till seeds. So till is also a good source of calcium. Other than that, you have your seaweed, you have your hazelnuts, your Brazilian nuts. So they are also rich sources of calcium. And if you're a vegan, then you can pick up products like till. You can product like tofu. Then also you can pick up products like almonds and green leafy vegetables, and also anjeer, which is known as figs. So you can consume all these products, and so it will be sufficient enough to meet your daily requirements of the nutrients which are also found in milk and milk products. So it's okay if you so we'll leave the topic with a viewpoint. It's okay if you're consuming milk, if you're fine with it, you feel healthy after taking milk, and if it is also okay if you are not able to take it in your daily diet, so you have other sources. And because it's okay, because people are allergic to lactose, and it can pose other than reaping the benefits, you're basically having problem if you're taking the dairy and dairy products. So it's totally a very individualistic viewpoint.